Hello, welcome to the Stellalife Innovator series. I'm Liz Lundry, and my guest today is Dr. Pascal Nguyen. Dr. Pascal has been practicing dentistry for over 20 years, having graduated with honors in biology at Concordia University in 1994 and receiving his doctorate of dental medicine at the University of Montreal, Canada in 1999. He's also a naturopathic medical doctor, a graduate of the Dawson Institute, and has continued his education with advanced courses in holistic and biological dentistry, implantology, sleep apnea, and patient care. Thank you so much for joining us today, Dr. Pascal.
You're welcome. Thank you, Liz. That's an honor.
No, thanks for your time. And as an integrative dentist, your approach to diagnosis and treatment focuses on finding the root cause of the patient's concerns. Please tell us about how customizing the treatment plans is based on this approach.
Sure. So, for example, when I get patients with cavities, I'll not just look for actual cavities. And when we think of holistic dentistry, sometimes we get boxed into like completely holistic, and dentists that are not holistic are not holistic at all. But it's a continuum, that some dentists are looking, of course, most dentists are looking for, are you flossing? Are you doing your hygiene? Are you eating the sugars? But I'll go further into things, for example, looking at, digestive problems. We don't really link digestion problem to cavities, but when your digestion isn't functioning, you're not making enough acid. And the acid is what's controlling the acidity in your stomach. That is what's controlling, the closing and opening of the valves of the stomach. And if you're not having good digestion, your acidity, will have a tendency, your acid will have a tendency to come back up and could demineralize the teeth and cause those cavities. So that is an example of, what I look for. We run a battery of tests. I do a lot of surgery, so we want to know the patient's health, not just from the sickness point of view, that are normally looked for. Of course, we want to know if there's high blood pressure, diabetes, and things like that. But I'll look for things like heart rate variability. Heart rate variability is an indication of patients' ability to handle stress. If you've had too much stress for too long, the next stressor could be a problem, more serious. And we can actually measure that with a number, which is the heart rate variability, not to be confused with heart rate. Heart rate variability is an indication of the difference between your sympathetic autonomic nervous system and parasympathetic autonomic nervous system. And the parasympathetic is where you rest, you digest, you repair, and things like that. And when the difference, or when that heart rate, the difference between those two is your heart rate variability. And it's been shown scientifically to really tell us, how patients are going to respond to stress, like a surgery, like, difficult procedures. And it's a very easy, non-invasive number to get that will tell us, how patients are going to respond to our treatment. At home, for those of you who are interested, that's actually also an indication of your actual biological age. So if your number is not good, it means you've had too much stress. You're not going to handle the next stressors really well. And you can actually know this number and work on this numbers. There's like really easy ways to track those things now, where in the past, like maybe 30 years ago, you would need to be in a hospital setting with big gears on, like, and it'd be really difficult to measure.
Yeah.
So that's another example of, how we check for things. Of course, we'll check vitamin D level. We have an epidemic of low vitamin D. And, it's linked with vitamin K to bone health. And of course, very well, what we do is, especially with the surgeries, implants, and extractions, even gum health with periodontal disease, that, vitamin D, vitamin K, very, very important. So, we don't diagnose vitamin D deficiency, but we can certainly screen for it. And, just like we do for high blood pressure. And if there's an issue, we can send patients to their providers and have them that checked. And most of the time, it's too low and it needs to be supplemented. And I won't um, operate on patients, unless I know their vitamin D level is good. And there's other markers too, but yeah, that's one there.
Yeah. Yeah, with technology, we can do so many more assessments, like with salivary diagnostics and other
Exactly.
tools to really get a full portrait of the patient. So we're not just putting a Band-Aid on something, but we're finding out why. And it's
That's right. That's
really
the root
providing
cause. I mean,
a complete
there's
service.
yeah, there's a lot of other examples of things we can check that way. You're talking about technology. Sure, a lot of your listeners, if you're, dentist or surgeon, that you're probably using 3D. Um, I think it should be standard of care. We get so much information. The price of the CBCT has gone down tremendously, but mostly what we see with that is just not comparable. You just cannot see things in 2D that you can see in 3D, and people should be screening with that, and seeing infections you can't see, issues you can't see, sinus problems, and of course airway issues.
Absolutely. And with that, if someone, you don't necessarily have to buy the equipment, you can send them to a lab, as long as you get that
Right.
imaging somewhere,
Of course. Yeah.
that's
Of
what's
course.
so important. So there shouldn't be a barrier there. But speaking about that and imaging, what is your opinion on root canal treatment and how it impacts overall health?
Right. So I have a little bit of a controversial, opinion on root canals. I don't believe in root canals. I don't do root canals. I used to do a lot of root canals, so it was a learning process. And I was actually asked by someone from dental schools to go do a specialty in root canals, but um, I see patients from doctors that send their patients with issues that they weren't able to find. So I'm a little bit biased. I see more problematic cases maybe than the regular, dentist. But when I take teeth out, I try to do microbiology, analysis. I'll put a smear on the slides and take a look, and there's always pathogens on there. Even when radiologically, or even with patient symptoms, it doesn't look like there's anything. But there's actual research from endodontic community showing that when you take teeth out that have been treated successfully, there's still pathogens on there. And I'm not saying root canal specialists are doing bad work, or but it is my belief that there's still pathogens in there, and they can be attracted to the teeth because the teeth can't defend themselves. And the body's not a sterile environment, so it's a problem. It's more so a problem for the patients that I see. But at the end of the day, if it was for me, for my wife, my family, I would not do root canals. um, I'd rather take the teeth out.
Yeah, it's that perpetual battle against biofilm and then the patient's immune system. And I think that we're going through an evolution of doing things better. And over
Yeah.
time, I'm sure we'll see differences in techniques to address that. Um,
Yeah.
I know that, keeping with speaking about pathogens, you've been using the Stellalife Vega Oral Care line since 2019. And you're also using Stellalife Dentamedica, as you address your concerns with vitamin D and K and other
Hmm.
micronutrients. Can
Correct.
you please share the healing aspect of your approach to root canal alternatives in dental surgeries and how Stellalife has helped with that?
Right. So when 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 I do most of my procedures, there's some kind of supplementation. It is our job as doctors to make sure that we oversee the patient's overall, successful treatment. And I, with my naturopathic degree, have learned that, I mean, it's not just because of that, but you, the body needs everything to be at optimal levels. So for example, for the supplements, I just won't do any surgeries without my patients having those supplements, because first, I know most patients, nutrition these days is just deficient. The food is devoid of all the good things, and it's not even to mention that there's a lot of counteractive things in the food like glyphosates and things like that, which will leach phosphates, and um, but our patients to have successful outcome need to have the proper level of supplementation. And I found with my research that, what you guys put together is just optimal. And I don't have to worry. I don't have to, send patients with 50 bottles, of different things. I just make sure they get started on that. And I know that they're going to have what they need for successful outcome as far as the supplements are concerned. The other thing that I really like, is the gel. So I use PRF to replace membranes. So let's say I do an extraction, if we do a bone graft, we'll cover the bone graft with an artificial membrane and the patient's own blood membrane, which is a PRP. And I found that the gel that covers over that is the best material to, the best product to soothe for pain, but also leave a protective layer that's also antimicrobial, and it's very easy to put on. It's not like something that would disturb my work. And if I am able to do a really atraumatic job, which is always my goal, I go through a lot of trouble, making sure we don't touch the bone, we don't touch the gum as much as possible, and things like that. With the Stellalife gel, it's often all they need. Like it's really, it works well, and it's powerful enough that it can be enough without any pain medication.
Yeah, it's I call it the magic gel because I use it as a clinician all the time, chairside,
Yeah,
whatever comes your way. It's so great to have that. So yeah, I totally agree, and it reduces
yeah, and
inflammation and all. Oh,
the material that's in there, those homeopathic medicine are just amazing. Like, do you know, in the rest of the world, most of the medicine used is homeopathic medicine. And the things that are in there, that's just, there's no secondary effect. I mean, I don't know if I mean, I know, but it's just such a big deal. We don't, you know give enough attention to, what does it do to patient when they get antibiotics, when they get um, you know ibuprofen and things like that, just affect the stomach and different things. Like, we sometimes we need it, and they're great for interventions, but they're just used like candies too much, and it has effects on the body. And when you don't pay attention to that, you're going to have some bad outcomes.
yeah, absolutely. The oral microbiome, the gut microbiome, all of that, all those links together.
Yes,
So it's a matter
yes,
of establishing and keeping that balance. And it's tricky because people eat packaged foods and, we live the lifestyle we live. Even if you do everything you're supposed to, we live in a world that's just inundated with all kinds of chemicals,
absolutely. It's
plastics.
very,
So
very, yeah, you're
yeah,
right, Liz. It's, we don't know because we live in it, but when you study and you do research, you realize like it's a very toxic.
yes,
Both the quality of the food has diminished, the things that are toxic that are in it, but we don't think about, for example, Wi-Fi, cell phone exposure, fumes from cars. it's very, very toxic. So it's very important for the body to be as strong as possible, to know these things. And you were talking about the biome. Um, I'm so happy that you guys came out with that, because um, I thought I was like, doing something special before, because I was giving probiotics, and I was trying to be mindful of good bacteria and eliminating only the bad ones. And you guys just packaged it all up, and made it perfect. So now, you're pretty sure that most patients' biome are not good. People are starting to be informed and being careful about the biome for the gut, but it's so connected. Whatever's in your mouth is going to be in your stomach. So if your biome is not good there, it's not going to be good in your gut. And so it's like a huge deal. There's a direct connection with
Yeah,
your biome via the vagal nerve to your brain and how you feel, and that's just scratching the surface.
yeah,
So but for health in general, when I want, like, when patients have gum issues, or when they have cavities, I automatically go to restoring the biome.
yeah.
And it's great.
Well, Hippocrates said, all disease begins in the gut, and he was right. And the
Yeah.
research now is really showing, how much we depend on how important that whole system is. We're talking
Hmm.
about 5 pounds or so of microorganisms in the gut, and then the relationship with the oral bacteria as well. It's all
Yeah.
connected. And so what you're doing with the care you provide and educating your patients is huge. So thank you so much for sharing what you do with us, and you help others learn about this as well with what you do.
Yes, absolutely. There's a big demand anyway, but there's a big message. I live my life with the um, in mind that I want to live longer, but I want to have a better quality of life, and particularly preparing for like those last years, where when you start having problems, that's when things degenerate. But if you do things now, in the end, it will be easier, it will be better quality. And so looking at the root cause, like you said at the beginning, and doing a lot of things. But yeah, for sharing the information, I'm trying to teach people about this, at least at the office, one patient at a time, but also on social media.
Great. Well, please keep up the good work.
Thank
Thank you
you.
so much for sharing your views and what you're doing. I think your work is incredibly important. So really appreciate your time with us today.
Thank
And
you, Liz.
thank you. And thank you, everybody, for joining us in this segment of the Innovator series. Come back next time, and we can learn more from other wonderful innovators like Dr. Pascal Nguyen.